So is the pillow face fading in the aesthetic plastic surgery world? Well, this is Dr. Ramsey Choucair, board-certified plastic surgeon in Dallas, Texas, coming to you with another educational video. So today we're going to talk about the pillow face, which the lay press has labeled. Someone has basically been filled so much in their face with either filler or fat that something doesn't look right. And so pillow face is really not a term that is something that's aesthetically pleasing. It's something that doesn't look normal. And as I tell patients, trying to reestablish the fullness in the face that you may have had in your 20s and 30s as you get older, maybe in your 50s or 60s, is never going to be looking as normal. It just can't, because that's not the way we age. And even if we try and reverse the aging, it doesn't look the same. So usually fat or filler is placed in the face to try and restore some volume, but usually it's carried to the point to try and avoid surgery. And at some point, plastic surgery to elevate the ptotic tissues, the loose tissues, it's what's necessary. And we're learning now that people are coming back to the fact that, yes, I wish I could do something simple like fat or filler to make me look youthful, but it's not working. And in those cases, it's usually always a facelift type procedure to re-elevate the loose tissues instead of just simply filling it out.